In eye care, 2020 vision means clarity, but leadership requires us to see beyond 2020, beyond the day to day, beyond the challenges, and beyond what's possible. Welcome to Beyond 2020 Leadership. I'm your host, Tamara Nord. And today, we're talking about something that makes many optometrists, practice leaders, and eye care professionals immediately tune out when it comes up in meetings: financial metrics. More specifically, we're tackling a term you've probably heard in corporate optometry, private equity conversations, executive meetings, or growth strategy discussions: EBITDA. That's EBITDA. And if you have ever found yourself nodding along while secretly wondering what everyone is talking about, you are not alone. The title of today's episode is Protecting Patient Access While Developing Your Business Acumen. EBITDA what? Because whether you're leading a single location private practice, managing multiple clinics, working within corporate eye care organization, or just simply navigating the realities of private equity-backed optometry, understanding business fundamentals isn't about becoming a finance expert. It's about becoming a better leader. It's about protecting patient access. And it's about ensuring that the practices we build today are still here serving patients tomorrow. Throughout my career in both corporate and private equity optometry, I've learned that some of the most impactful leaders aren't necessarily the ones who know the most clinical information. They're the ones who understand how to connect clinical excellence with business performance. Because when a business is healthy, it creates opportunities. And when a business struggles financially, even great intentions can become difficult to sustain. So today, let's demystify EBITDA, talk about why it matters in eye care, and discuss how developing your business acumen can help you become a stronger advocate for your patients, your team, and your practice. Most of us chose eye care because we wanted to improve lives. We wanted to help patients see better. We wanted to detect disease earlier. We wanted to preserve vision. Very few of us woke up one day and said, I can't wait to learn about profit and loss statements. Yet whether you're in a private practice or regional group, a doctor-led organization, or private equity-supported platform, every practice operates within a business model. And every decision carries a clinical impact and a financial impact. So consider investments that many of us advocate for. There's advanced diagnostic technology, additional technicians, expanded patient hours, dry eye programs, myopia management services, specialty contact lens clinics, better training and development, new locations to improve access for our patients. These are all worthwhile initiatives, but every one of them requires resources, and resources are finite. Today's eye care leaders must balance these three priorities: clinical excellence, patient access, and financial sustainability. If you ignore any one of those, the entire model becomes difficult to maintain. Outstanding patient care without financial sustainability ultimately struggles to survive. Strong financial performance without quality care is going to damage trust. Access without sustainability eventually becomes impossible to support. And that is why business acumen matters. It allows us to advocate for our patients while understanding how decisions impact the long-term health of the organization. So what is EBITDA? Now let's talk about the term that inspired today's episode. The acronym stands for Earnings Before Interest, Taxes, Depreciation, and Amortization. And yes, I realize that that is the point many people immediately stop listening. So let's simplify it. Think of EBITDA as a measure of how a business is performing from its core operations before certain accounting and financing considerations are factored in. Or let me make it even simpler. EBITDA helps answer the question, is this business generating healthy operating profits from what it does every single day? Let's use eye care as an example. Imagine two optometry organizations. Both generate the same revenue. One owns all of its buildings and equipment. The other leases most of its locations. One has significant debt from acquisitions, and the other has very little debt. Their bottom line income may look very different. EBITDA attempts to level the playing field by focusing on the operational performance. It's not perfect, but it does give leaders and investors a way to evaluate effectively how the organization is performing, breaking down the components. If we were to unpack the acronym, let's think about that. Earnings. This represents profit that is generated by the business before interest. Interest reflects borrowing costs. If an organization borrowed money to acquire practices, remodel clinics, or invest in growth, those financing decisions create interest expenses. Those costs don't necessarily reflect how well the practice is serving its patients. Before taxes. Taxes based on business structure and ownership, again, they don't necessarily indicate strong day-to-day operations or speak to them. Before depreciation. Depreciation reflects the gradual accounting expense associated with physical assets over time. And in eye care, that might include a few of the following. We have OCT equipment, Optimap systems, visual field analyzers, lens edgers, diagnostic technology, building and leasehold improvements, and before amortization. Amortization generally relates to intangible assets. For example, software platforms, intellectual property, you have practice acquisition assets, there's certain contractual rights. By removing these factors, EBITDA focuses more closely on operational performance. So why does EBITDA matter in corporate and private equity optometry? Because there are many eye care professionals that haven't encountered EBITDA, but this is where they may. In a private equity-backed organization, EBITDA is one of the primary measures used to evaluate business performance. And if you've ever sat through an executive meeting and heard conversations about EBITDA growth, EBITDA margins, EBITDA performance, multiple expansion, practice valuation, this is why. Investors want to understand how effectively a business operates. And leaders want to understand how much financial flexibility the organization has for future growth. And here's what I've learned working within both corporate and private equity environments. Many clinicians hear EBITDA or scoreboard or financials and assume leadership only cares about money. And that's usually an oversimplification. What leadership is often evaluating is the organization's ability to continue investing in growth. The organization is asking, can we add locations? Can we invest in new technology? Can we recruit doctors? Can we expand patient access? Can we create better career opportunities for our staff? Strong EBITDA often creates more options, and a weak EBITDA will limit them. So let's make this real. Imagine that your organization wants to invest in comprehensive myopia management and develop an entire program. Clinically, the value is clear. Patients benefit from earlier intervention, families receive better education, long-term outcomes improve. But leadership still has to answer the critical question: how do we fund it? And this is where business acumen becomes a leadership advantage. A leader who understands both clinical and financial considerations can definitely explain the patient benefit, the practice growth opportunity, the long-term retention potential, the differentiation in the marketplace, the revenue impact, the sustainability of the program. So some of the things I think of, instead of simply saying that this is good for the patients, you can confidently say, this is good for the patients. It strengthens our clinical model and it supports long-term business performance. That's a much stronger leadership conversation. EBITDA is important, but it's not everything. Now, let's be careful, because EBITDA is a valuable metric, but it's not the mission. The purpose of eye care is improving patients' lives, and not everything that matters can be fully measured by EBITDA. So we get to consider things like community outreach programs. You have school vision screenings, services in underserved communities. There's patient education initiatives, charitable vision efforts, and some of these initiatives may generate limited financial returns, but yet they create a very tremendous value. And the best leaders understand that metrics should inform decisions, not replace the mission. In great organizations, financial performance supports the mission. It doesn't become the mission. So by developing your business acumen, the good news is you don't need an MBA to become more business savvy. You simply need to be curious. Curiosity. Here's a few practical ways to start. Learn basic financial language. Become very comfortable in conversations with terms such as revenue, expenses, gross profit, EBITDA, margins, KPIs, cash flow, return on investment. You don't need to become an accountant. You just need to understand the conversation. Start by asking direct questions. When evaluating a new idea, ask, how will this affect patient access? How will we measure success? What resources are required? What return should we expect? How does this support our strategy? These questions will elevate your leadership perspective. Understand your practice's own economics, because every doctor and leader should have the basic understanding of exam volume, capture rates, revenue streams, staffing costs, technology investment, operational expenses. Not because money is the goal, but because sustainability matters. Build relationships with financial leaders. Some of the most valuable lessons in my career came from finance partners who helped me understand the business behind the practice. Finance teams and clinical teams are not on opposite sides. At their best, they're working towards the same objective: a healthy organization that can continue serving patients, speaking the language of leadership. One of the most important skills that you can develop when learning to speak the language of leadership is translating clinical value into business value. Let me give you a couple examples. Here's some clinical language. Our new dry eye program improved patient outcomes, but a leadership language will sound like this. Our dry eye program improved patient outcomes, increased patient retention, and expanded service offerings. And it created a differentiated patient experience. Here's another example. If I was to use clinic language, patients appreciate having evening appointments. Leadership language will sound like this. Extended hours improve patient access, enhance convenience, increased appointment availability, and strengthen patient loyalty. The facts haven't changed. You're just simply connecting the patient outcomes to the organization objectives. And that's what effective leaders do. Seeing beyond 2020. The eye care industry continues to evolve. We're navigating workforce challenges, reimbursement pressures, rising operating costs, increasing technology and investments in technology, consolidations. There's corporate growth, there's private equity partnerships, there's consumer expectations. The leaders who will thrive are those who understand both sides of this education and the equation. They understand patient care and they understand the business. They can advocate for clinical excellence while helping ensure that the organization remains sustainable. And they can explain why investments matter, not only because they improve the outcomes, but because they strengthen the future of the practice. Most importantly, they understand that protecting patient access requires more than clinical expertise. It requires business acumen. Because when practices thrive, the patients benefit every single time. And when leaders understand both mission and margin, they help create organizations that are positioned to serve communities for years to come. And as we wrap up today's episode, here's a key takeaway that I want you to take with you. EBITDA isn't just a finance term. It's one way organizations evaluate operational health, their ability to continue investing in growth, innovation, and patient care. You don't need to become a CFO. You don't need to become a financial analyst. But understanding concepts like EBITDA can make you a strong leader, a stronger advocate, and a more influential voice in conversations that are shaping the future of eye care. When we develop our business acumen, we gain the ability to connect purpose with sustainability. And when we connect purpose with sustainability, we help protect what matters most, and that is access to exceptional care. Thank you for joining another episode of Beyond 2020 Leadership. And until next time, keep leading with purpose and remember to see beyond today.